Now it's my pleasure to introduce our 2017 Seeds of Hope honoree, Dr. Ricardo Nuila. Many of you are familiar with Dr. Nuila from his writing for the New York Times, the New Yorker, Atlantic Monthly, and other publications, and from his fiction. In addition to being a writer, he is a professor at both Baylor College of Medicine and the University of Houston Honors Program, and a practicing physician at Taub Hospital. A tireless advocate for health care for the underserved, Dr. Nuila is also a volunteer physician for them. Last month he cared for those taking refuge from Hurricane Harvey, and has made numerous trips providing medical services in countries including Haiti, Honduras, Kenya, and the entire continent of Africa. Dr. Nuila, would you please come forward?
It started with something I probably should have anticipated. We started taking my 21-month-old daughter to daycare recently. And I remember in medical school, a cell biology teacher telling us that when his kids pick up something off the ground and put it in their mouths, even no matter how repugnant it smells, he lets them. Old Fruit Loops, pancake batter from who knows when. They put it in their mouths and he would say, "Good, they're improving their immunity." And it's true, at 22 months, the immune system is dynamic. You need to expose it to possible future illnesses. But what he didn't say is that when the kid exposes herself to these pathogens, the parents get sick too. Okay? Yeah, thanks, Professor Rowley. Thanks a lot, I appreciate that. So that's what happened. My little daughter started going to daycare and we got sick. I started hearing a ringing in my ears and I was stuffed up. You can hear it right now. I couldn't sleep, so what did I do in the early hours of the morning? I checked my phone. And what in the very early hours of this week, what did my phone say? That more than 50 people had lost their lives in Las Vegas, with 500 more injured. Now, I was raised in Houston, and I have very good friends that are gun owners. I've had rational conversations about guns with good people, some of which have made me rethink my positions. But I felt powerless from the Las Vegas news. I felt that our Congress wouldn't be able to address the situation, that the bickering had gotten out of hand, and that lawmakers would dig in their heels again. I felt buried by our democracy. I was texting and emailing about this with friends so much that at some point I said, I need a break. So what did I do? I turned on the TV. Now, we usually leave it on PBS because my daughter loves Curious George, and actually I do too. So I turn on the TV, and of course PBS is on, except it's not the man in the yellow hat, it's Frontline. And what's on is a story about North Korea. Great. More powerlessness. We're on the brink of nuclear war. Hundreds of thousands, if not millions, of lives hang in the balance. And there's nothing that I can do about it. So I was feeling quite powerless, and I knew I had to write this speech about poverty. Great. Something else to make me feel powerless. I started going through materials, looking at what some of the great writers had said. Then I found something. I'm going to read it to you now. The smell of poverty cannot be described, although it is the same all over the world. I had smelled it in India, in Paris, in prison camps during the war, but most unforgettably when the first inmates of the Nazi concentration camps came home after the liberation. It brought back to mind images of hordes of people reduced to an animal status, fed by officials doling out food scooped from barrels on the windy platform of a railway station. I had seen freight cars full of human cattle disgorge their crazed contents onto that platform. I had seen well-intentioned humanitarian officers start out by trying to treat them as unfortunate human beings. Before the day was past, they were yelling at them, hurting them, pushing their milling, mindless mass around as cowboys push a herd of cattle. I suppose they ended up that way because of the impossibility of identification. It was impossible for normal civilized men to identify with those stinking, unshaven, dirt-caked, lice and disease-ridden human wrecks. No one could realistically imagine the conditions these people had been forced to subsist in, which had resulted in their reduction to a panicky herd of cattle, milling aimlessly on the brink of a stampede. I'd forgotten their smell. It hit me again after all those years as I entered Jefferson Davis Hospital in Houston, Texas. Now, this quote appears in a book called The Hospital. It's about the abject conditions of the charity hospital in Houston in the 1960s, as observed by volunteer John de Hartog. De Hartog was Dutch. He wrote plays and novels. Through many twists and turns in life, he found himself in Houston, like so many of us do. He was the type of person that wanted to help out the community, particularly the poor, so he volunteered at the charity hospital, Jefferson Davis. What he found was that the conditions were atrocious. These doctors that volunteered and that learned medicine there cared, but there was no funding. In fact, the city and the county fought over who should give money to Jefferson Davis. They dug in their heels and washed their hands of the problem of these poor people in this hospital, forgot that they even existed. De Hartog wrote a series of editorials that appeared in the Houston Chronicle, and then he wrote a book which detailed the struggle of an enlightened few in Houston aware of this problem. People knew that the conditions were terrible of this hospital. They wanted a change. And so this group of people, this enlightened group of people, did what they did was form an institution. They formed the Harris County Hospital District. This institution was founded politically to have its own taxing authority, the way that school districts have their own taxing authority. This was a group of people like the people in here that are both Republicans and Democrats that cared about poverty. This institution was founded politically, they had their own taxing authority like a school district, so that the indigent in hospital would always have care. Jefferson Davis Hospital was raised and Ben Taub was erected, and that's where I work today. Now let me tell you about one of my patients. I'll call him Mauricio. I met Mauricio after he lost the ability to stand and to smell. You see, the cancer had spread throughout his body, everywhere, including his brain. He was originally from Guatemala. Like so many of our patients, he stayed in the US illegally, but it didn't start out that way. At the age of 49, he emigrated on a work visa to pick watermelon in California. Why did he come so late at the age of 49? Because a drug dealer ran over his daughter in a pickup truck, shattering her femur. Remember that 50% of the cocaine entering the United States goes through Guatemala. An infection of the bone set into his bone, and complications followed, into her bone, requiring multiple surgeries. Very quickly, the cost of her care shot up into the six figures, dollars, not quetzales, in Guatemala. And so Mauricio, the dad, a soft-spoken farmer, did what he had to do. He joined a group of men, younger men, and headed to California. He left his home. By the time I met him, he couldn't stand, and everything smelled the same to him. Mauricio arrived in California with the hope of earning money for 2 years before returning home, but the harvest ran dry, and so he followed work to Texas, where he found employment as a painter, landscaper, and tree pruner. He sent $250 home to his daughter every week, $150 when things were bad, and paid $210 monthly in rent. Things were going well around the time his visa expired. He worked 60 hours a week. His daughter was walking again, and he'd made friends among both the Catholic and evangelical factions of the Guatemalan migrant workers. He spoke, when we had conversations, he often spoke of faith and expressed incredulity regarding these wars, sometimes waged with machetes between these Christian groups. Then, he was working high up in the trees one day, painting. He began to shake. Soon he couldn't paint without coughing. He started falling off ladders, and he began to limp. Once his boss realized he'd become a liability, he dropped him off at our hospital. We found the cancer in his bones, growing out of his groin and his spinal cord everywhere. The final diagnosis was metastatic squamous cell cancer of unknown origin. The oncology service recommended hospice care, since Mauricio appeared too frail to withstand chemotherapy. Now, in the United States, many undocumented immigrants that are dying are forced to go through a revolving door. Mauricio, in other parts of the United States, would go to the ER for pain medications, and they would send him home, and then he'd go back to the ER for pain medications, and they'd send him home, until one day he wouldn't go back. Ben Taub is different. Patients that are dying can even receive hospice care or pain medications, even chemotherapy if it helps them, even when they are undocumented. What Mauricio wanted more than anything was to go home, though. He wanted to go home. And so a group of people worked together, everyday people within the hospital, medical team, that included social workers, nurses, and they talked with the Guatemalan consulate. 2 weeks after I discharged him from Ben Taub, I didn't discharge him to his apartment, not to the emergency, I didn't discharge him to the emergency department, but to his home. I received the message that he had died, but he had died at his home in Guatemala. The woman from the consulate gave the news to the whole team of people that had worked together to fulfill Mauricio's dying wish, including the nurses, the medical students, the social worker. She sounded sad when she gave me the news, and it wasn't difficult to know why. She had accompanied him, the lady from the Guatemalan consulate, from Ben Taub through the airport and onto the plane. She'd arranged for a doctor to see him in Guatemala. She delivered him to his little ranchito in the Caribbean coast, a group of individuals working together enough so that he could receive a dying wish. Now, Jean de Hartog smelled poverty and powerlessness at Jefferson Davis Hospital. 50 years later, the smell is gone at Ben Taub, the institution that takes care of Houston's poor. We are almost in 2020 and the care for the poor has improved in our city. I'm here to tell you that. Don't take my word for it. Just one story. Look at the stats. In 2014, according to the National Cardiovascular Data Registry, Ben Taub posted the best door-to-balloon time in the country, which means that it has provided the fastest and therefore the most important heart attack care. This is a hospital that's designed to take care of poor patients, and it provides the best heart attack care in the country. What do I learn from this? Well, I want to tell you tonight that there's hope for the future, and it lies in our great institutions. We can feel powerless in all situations, but there is always hope. Mauricio was going to die, but the people caring for him found a way to create hope by working together. It's one of the reasons why I'm so happy to speak on behalf of Results tonight. Results is a larger institution that works to end poverty by working with other institutions. It's lobbied for the vaccination of children, for the expansion of Medicaid, for meals for the first 1,000 days of the children's lives, even when they're poor. Donations to Results strengthens great institutions and it empowers people. That's not to say that Harris Health and Results have won their respective battles. Let us remember that this is a process. This week, in the midst of texting about feeling powerless with the gun problem, a friend texted me an article about how people felt exactly this powerless 50 years ago with the smoking lobby. Okay? It was too strong at the time, and everyone felt buried. Fast forward to today, and we have hope with regard to smoking. We haven't solved the problem, but at least we've identified it, and people have hope with regard to it. We have hope in caring for the poor. We have hope because we know that if we work together, we can act compassionately toward one man, toward Mauricio, and then another, and then how many? There's still much to be done, but there's always hope. Thank you.
Thank you, Dr. Nuila, for sharing your incredible story with us and all the great that you do and the other wonderful physicians, social workers, nurses at Ben Taub do for all the least served in our community. Truly outstanding. Let's give another round of applause.